Years ago, when I first started learning about mold, I was at the ILADS conference in Boston, I believe. One of the doctors was talking about getting sick from mold in her own home. And she had, back then, this was 2010, maybe 11, she was talking about having to get rid of everything and live in a pristine box, lab level clean. At the time, we didn't know as much as we know now. And I think that is an effective way to do it. And if you can do that and even live on the beach and have ionized ocean air to boot, that would be awesome. You probably get better really fast with medicine. But, it's pretty rare that somebody can do that. If somebody has an issue of water damage in their home and they own their home, I always refer them to an environmental professional who can walk them through what to do to clean to the level that we need them to. I'm sometimes surprised because the people that we work with across the country, I've never had anybody say you have to move out of your house. Even in climates, I have patients in Minnesota or the East Coast, I've never had any of them not be able to figure out how to fix their home. Now, it often is required to do a thorough spring clean, get rid of clutter, clean, windows, walls, ceilings, wash everything. So it's not that it's not a big job. And do you need to get rid of everything? I mean, for one thing, no. I can't imagine getting rid of your children's photographs or your heirloom paintings. Books are a big deal for people too. And unfortunately, because mold likes paper and it eats it like sugar, those are things that may need to be stored for a while. But I wouldn't say that anybody needs to get rid of everything. If you can clean your space, make sure there's no ongoing growth of mold, I'm not saying any of this is easy, but it's totally doable. And if people are worried about, well, I can't do anything about my mold toxin because they're going to ask me to get rid of everything I own and move, that is absolutely not true. As time passes, we have more tools. I have patients who live in homes with visible mold who maintain with IV ozone and IV NAD, and they still work and they actually do pretty well. Now, is it better to just be in a bubble and do what you need to do? Yeah, it's faster. It's also impractical for a lot of people. They should seek treatment even if they're living in a moldy building, because you can overcome those things.